going to?
So I always say the founding kind of mantra was there has to be a better way to practice medicine, to receive care as a patient, to finance medical care. All those things existed. And then we came to the core focus statement, which is solving healthcare challenges for members. And that makes sound really silly. And we haven't talked through exactly what direct primary care is and kind of the core of who we are, but solving challenges has been evident from day one. So examples, the building the COVID-19 testing, rapid and PCR testing that could be done at a time period faster than anyone else in the Des Moines metro when this started, as well as the cost. So we moved the entire market from north of $150 we moved to $89 for our PCR and $65 for our rapid tests with a 1 hour turnaround and guaranteed next day for PCR. Next up, as Nate had alluded to, we talked about the Central Iowa Shelters and Services clinic that we put together, and that was on the need for a clinic to come in and take care of folks right as a really bad cold snap in Iowa was occurring. Projected weather was below 20 degrees Fahrenheit plus wind chills, and it was expected there would be a lot of frostbite and cold-related injuries. And within a week, we set up a clinic to start triaging and taking care of folks, and subsequently moved into taking care of that population day in and day out. Additionally, there's a behavioral health hospital that we ultimately staffed from the medical standpoint because they were having issues really making it make financial sense from the way they were initially structured. So like I said, it sounds silly that we say we solve healthcare challenges, but that's really who we are and what we've done. And some other examples we'll talk through include building APLOS health plans, which is another one that looks at how do you put together a health plan that really serves the employees to make sure they're getting the care they need, and then also the employer groups and extracting out the waste and all of the costs that folks are paying as the employer that ultimately are just lining someone else's pockets and not really delivering care to folks. So